Well, peri-implantitis is well defined in the literature, and there has been a lot of consensus about it. And today it's a condition, it's an inflammatory condition that has certain characteristics, and it's happening around our implants. So it's inflammation around our implants that creates bone destruction and this incremental probing depth and some bleeding of the soft tissues around our implant. So this is the definition, right? But it does two other characteristics. One of them is that it's site-specific, which means that in a single patient, not all the implants may have peri-implantitis, maybe just one, which is somehow the situation that happens with this very aggressive periodontitis that only affects a molar, for instance, and is able to destroy the bone support of the molar and not affecting the rest of the teeth in the mouth. And the other one is that it's a non-linear accelerated situation or condition, which means that you may have like 10% of bone loss in the past 7 years, and in 1 month you can lose half of the bone support, which means that it's not the same amount of bone loss every year, but in 1 month may go from 0 to 100, right? So with these two specific situations, that also has some connections with the foreign body reaction. So it's like, there are two theories, one coming from the Albertson group and the other one coming from Nobel. Nobel is more bacteria, and Albertson it's more a foreign body. I really believe that it's a combination of both. The two things are combined. So the only thing that is in between the bacteria and the implant to bone contact is the soft tissue. What we know today is that peri-implantitis begins when this barrier, this soft tissue that keeps the bacteria away from bone, break. This barrier is destroyed, and then the bacteria are able to go through the soft tissue in direction to the bone, and they use the implant body as the path to go into the bone, right? By knowing that, we can create some strategies to fight against peri-implantitis. So first of all, we need to go back to year 2000. So before year 2000, we had the old Brammer surface, which was considered as smooth machine surface. And some of the companies in the market had very rough surfaces like TPS or HA-coated implants. But after year 2000, there was a movement in the market, and Nobel changed from this smooth surface into tionite, an oxidized surface. And other companies moved from very rough surfaces to medium rough surfaces, okay? Subtracting or adding roughness to the titanium surface by different procedures, okay? But then this movement was mainly because of the advantages of the rough titanium. And which are the advantages of rough titanium? Advantages of rough titanium are less healing time, faster bone growing on top of the surface, more bone to implant contact. So the ideal surface in order to perform certain procedures like immediate loading, for instance, or by shortening the healing times. This was something desirable, and it was something good, okay? Then, with time, we realized that rough surfaces does not perform so good when becoming contaminated, okay? So we have like a decision in between two things. What do you want? You want a lot of bone to implant contact, or you want a smooth surface that we already had in the past that has less bone to implant contact but perform better in front of bacteria. And that was a dilemma that had no answer for years. What we have today, because innovation in the industry, because Nobel Biocare, is an implant designed in the way that we have the roughness that we need, or the best of two worlds. We have a less rough upper part of the implant that can be in contact with bacteria in the future, so it's easier to treat if become contaminated. It becomes disintegrated, we know that. And but if we find ourselves, or the implant find itself in a situation that becomes surrounded by bacteria, we know that we'll perform better that very rough surfaces. And then we have at the same time, in the same implant, the tip of the implant, as we go deep in the implant towards the tip, we have a more rough surface, TiUltra surface, that it's better to obtain this interlocking in between the bone cells and the implant surface. Is what we need again for immediate loading, or to performing better in soft bone, type 4 bone, which were the limitations of the original smooth surface or machine surface, which is a better definition. So it's called a hybrid design. Hybrid means two different roughness in the same implant. Okay, and this is important because there are some others in the market, but there are also some others in the market saying their implant is hybrid and it is not. And it is important. It is the hybrid design. We're talking about the intrabony, the part that is inside the bone, not the part that is outside the bone. Okay, this is important because bone loss may happen in the future, may happen because of physiological reasons, may happen because overloading, may happen because pressure of the prosthesis, may happen because of thin, soft tissues that are not able to behave well under pressure or under cleaning or brushing or whatever. And this, or one of the main reasons, is that the amount of bone we leave around our implant is less than 1.5. And this is an important and very nice article done by Alberto Monge, in which he ended up with the idea that every cortical plate around an implant, which is less than 1.5, eventually can resolve in the future with no reason. I mean, just physiologically, no inflammation, no infection, just physiologically, this bone can resolve. If we think about the ridges, bone ridges, how many ridges we have that are 7 millimeters in thickness? Not a lot. If we are placing a 3.75 implant, we are leaving less than 2 millimeters on each side. So it's quite easy to end up with a situation in which this less than 1.5 bone wall will resolve. What happens is that the part of the bone that is the part of the implant that's inside the bone will become exposed. And we get the advantage of having a less rough surface being exposed. Not contaminated yet, with no bacteria under the soft tissue, but this can be easily contaminated by bacteria, okay? Then some other factors may play a role. But at least we have this less rough part of the implant that will make our antibiotic more effective, antibiotic treatment, that will help our assistants, our hygienists, to clean properly this exposed surface of the implant. So it's an amazing design. For me, I'm only use TiUltra today, even though I know that Nobel Biocare has a lot of different designs or whatever. Basically, what I use today is, I would say 2, but 3 N1 implant, which is TiUltra by nature, active, Nobel active, TiUltra, and parallel TiUltra. Those are the 3 implants that I use. And I use 3 and not 2 or 1 only, because I really want to provide my patients with the best design for this specific situation. So I'm still using wide implants, shorter implants, different designs depending on the bone or the conditions around the implant site. But yeah, this is TiUltra for me. I cannot live without it. I cannot live without it. That's my number one product that I use today. I will make a differentiation in between the human part and the part that corresponds to companies and product itself. So from the human part, that's the patient and the team and the dentist. What we have, what I always say is that we need more information for the patient. We need to inform the patient that this may happen in the way that he will participate somehow in the detection of the problem. This is important. And also maybe he or she will be more enthusiastic applying hygiene protocols or whatever, knowing that something wrong may happen. Because we told them that life was, with no problems with their implants. No. Not even train them properly in cleaning those implants. And this is important. So, from the patient, information, it's very important. From our side, as doctors, we need to improve the way we teach the patient. We train the patient in cleaning. We design the prosthesis in the way that the patient will be able to clean properly, and taking into account the situation that we spoke before about, that patient will become older or may had some other conditions that will make cleaning more difficult, right? Or will make bacteria more powerful, right? Like diabetes or some other conditions. So we need to train the patient, we need to train the team, our team and ourselves, in order to create a sustainable treatment. Sustainable treatment means you do the treatment, you put your implant, you retrieve the sutures, you take the impressions, you put your prosthesis, and then you follow these patients for their entire life. And basically what you need to look for in the future is how the quality of the sealing of the soft tissue and the quality of how the patient cleans around the implants, which is very important. So this is part of the team, right? And also the amount of visits for the patient, that we say at least every 6 months, right? For sure, from the dentist's perspective, we need to place our implants in the best position possible. We need to design our prosthesis the best way to be clean by the patient, and then from the side of the companies, I will say that the product itself, I would say that we need to learn from the past, and we need to do not replicate the problems we did in the past, and we need to plan for the future. Learn from the past and plan for the future is the way to avoid problems. And for sure, companies are designing their products in the way that it will be easier to maintain, it will be easier to keep clean around those implants, and to keep this sealing, soft tissue sealing in a better way. I say always that the economical crisis that we had here in Europe in late 2008, with the subprime and these economical problems, this create an impact in implant treatments, because a lot of dentists try to save money by not using abutments in the restorations. So also the CAD-CAM The CAD/CAM production was telling us that the adjustments were very good, and we were able to go directly on top of the head of the implant, meaning avoiding the use of abutments. And that was a big mistake. That was a big mistake, because that fit was not so good most of the times, because some screws can become loose with time, and then we will have bacteria and movement close to the bone, which means that these bacteria will create products that will interact with the bone, creating some inflammation, some bone resorption, leaving the head of the surface of the implant exposed, which is again the beginning of the problem, right? So by training our patients, selecting our patients, training the doctors in order to place the implants in a better position, in the best position possible, using the tools we have in the market, like software, guided software, the surgical guides, or the navigated surgery, training our team in order to clean and to properly maintain the prosthesis clean, using the best materials available in the market, titanium, zirconia, the shape of the prosthesis that allow us to clean it properly and maintain it in time, and by asking the companies to further investigate in new products that will help us in getting these results,